Supplements for ADHD, what works, what doesn't work, and what you should be worried about. So upwards of 50% of people who have ADHD actually use supplements to try to treat it. And some people use it as a first-line treatment. The reason I actually started thinking about this was because I was getting a haircut last week and my hairstylist was just like, yeah, so I'm fairly certain I have ADHD, but I don't actually want to take ADHD meds, so I'm just trying some supplements for it. And this made me a little bit worried because ADHD meds have far more regulation than supplements do. So supplements are just kind of left on their own. So they don't really have to prove that they're effective for anything. In fact, they can't claim that they're effective for anything. They don't really have to prove that they're safe. They just have to monitor any adverse events that happen. So if something bad happens, they have to tell people about it, but it is up to them to actually be able to say it or not. That was like a self-report of harm that they have to say. But other than that, they're basically just allowed to be on the market. And there are a lot of studies showing that what's in supplements are either not what they say or things like heavy metal or even steroids. I have an entire spiel about this. I wrote a chapter in my last book about this. This is something that is actually decently problematic. So in the case of using supplements versus ADHD meds have way more evidence that say that they are effective and way more evidence that say that they're safe. Now, this does not necessarily mean that one of them is going to work for you or they're not going to have terrible side effects, but at least they have been tested. Now, with that caveat out of the way, let's talk about some of the specific supplements and whether they work to help with ADHD symptoms. So the first one is the polyunsaturated fatty acids. So these are things like omega-3 and omega-6. Now, out of all of the supplements, the omegas seem to have the most evidence to suggest that they might work. So we see that things like melatonin might help with some of the sleep problems that you see, but they might not actually help with the ADHD symptoms. However, the omega-3 could actually help treat ADHD symptoms. So out of all of them, this one has the most scientific evidence behind it. Now, what about carnitine? So it seems like either carnitine or L-carnitine or acetyl L-carnitine, none of them actually seem to work. Now, iron, zinc, and magnesium are commonly brought out as things that could potentially help treat ADHD symptoms. Now, the problem is that those have been linked to kind of low levels in ADHD. And if you're treating some of those low levels in ADHD, that might be able to help the symptoms. But if somebody does not have low levels of things like iron or zinc or magnesium, getting to those higher levels, that might not actually help anybody. And in some cases, so things like iron and especially for things like magnesium, too high of levels are very problematic. So magnesium, especially in high levels, is problematic for people with kidney disease, and it can be fatal in high enough doses. So it is definitely not recommended to just try as a thing that might work for ADHD. Now, as a side note, I am a PhD, not an MD, so I am not recommending any of these things to you because I cannot give you medical advice, nor should I, but these are just kind of the scientific facts behind them. Now, what about ginkgo biloba? Well, it's supposed to help for things like cognitive symptoms and help with things like dementia, but it doesn't really have good evidence for much of that. And for ADHD, it has very little. And ginkgo has a lot of interactions with a lot of other drugs, similar to St. John's wort, which is also recommended as a treatment and also does not seem to do much of anything. Now, copper and selenium are also suggested, but copper and selenium don't seem to do much of anything. There's very little evidence, even in comparison to these other supplements that also have very little evidence for them. So omegas, kind of the best. The things like iron and magnesium and zinc, yeah, not much there. And things like copper and selenium, even less. And once again, the supplement industry is very unregulated. So in general, although I give them to my pets and I sometimes take them, I don't know if I fully trust supplements. So we need to do more research to see if they work, but also we need a better system that allows them to be tested and regulated so that if they do work, you have a safe way of getting a hold of them.